Hello, good day, everyone. Good day, everyone. A very beautiful morning to you all. I want to welcome everyone participant who's joined us already for this live question and answer session on IVF treatment. Thank you for joining us. We trust that in the course of the session, we would have more persons joining, but for the sake of time, we're set to begin. So I want to thank everyone who is here already, and I'm pleased to be a co-host for this session. And I'm not doing this alone. I am pleased to be co-hosting with Oluchi Oladapupo. She's a clinical embryologist at Lily Fertility Centre. We're also privileged to have one of us here, a senior consultant, Dr. Imo Nelson. And also, we have Mr. Eddie Ilenre. He's a senior clinical embryologist. They are going to be addressing our concerns, every question around the subject, and providing insights throughout the session. Once again, I want to thank you for joining us, and we look forward to a fruitful conversation around this. Thank you so much. So I'll have Madam Oluchi Oladapupo. She's a clinical embryologist at Lily Fertility Centre. Take us furthermore on the session. Thank you.
Okay, thank you, Mrs. Ovoke, for that wonderful intro. I'd like to welcome everyone to this webinar. It's a section where we'll be answering all your questions, all the questions that have bothered you on IVF treatment, the promo, everything about Lily Fertility Centre and its promo. Any questions you have all around it, to have professionals in the house that will be answering your questions. So with that, I'd like to introduce Mr. Endurance Ilinre to talk to us about Lily Fertility Centre, what we do, and what the IVF promo it's all about. I'd like him to just walk us through briefly on what we do. Thank you, Mr. Endurance.
All right, good morning, everyone. Hope we had a very restful night. And thank you so much for joining in. IVF, I would like to just talk briefly about what IVF is generally, though we have a residual knowledge of what it means. So it's simply an acronym that represents in vitro fertilization. In vitro fertilization, that's what IVF is. And in vitro means a process that takes place outside the living organism or outside the body, while in vivo is a process that takes place within a living organism. So because the fertilization during the process of IVF is done outside the body or outside the body of the woman, we call it in vitro fertilization. Now, IVF itself comes under the umbrella of ART, assisted reproductive technology. Like you know, infertility is not a medical condition that just started yesterday. In fact, infertility is as old, almost as old as the dawn of human history, actually. Yes. Ancient times, people have battled with infertility, and it's been here with us. And over the years, medical practitioners and scientists have done their best to ensure that they try to proffer solutions to tackle this challenging medical condition of infertility. So IVF is one of the treatment options that comes under the umbrella of assisted reproductive technology, meaning we have other forms of treatment when it comes to infertility. We have maybe ovulation induction, we have IUI, we have some small surgeries you can do just to correct some issues. But IVF is like the apex. In fact, IVF is actually like the major breakthrough when it comes to the field of reproductive medicine. Because before the advent of IVF, there are some medical conditions that some couple will have that will just spell doom for them when it comes to conception. It means that they will just know that we can't have babies because of this present medical condition. They will just know that it is impossible, except maybe a miracle will happen. They can't have babies naturally or on their own. But the advent of IVF has helped to, correct those issues and overcome those challenges that would have proved like an obstacle to you having your own babies. In fact, for the over 15 years that Lily Hospital has been offering fertility service, I can tell that IVF has really helped a lot of couples so much. So, like I said before, it's a major breakthrough when it comes to the field of reproductive medicine. And over this year, we've done thousands of cycles, and we have achieved over 2,000 live births with so many ongoing pregnancies. And this is actually very exciting to share. The challenge with IVF is that it's a little expensive because of the processes involved. The medication used, the equipment used, the sterility of the environment is not really cheap. So because of that, once in a while, we try to see how we can crash down the price of IVF so that many persons will be able to afford it or key into the treatment option of IVF. So during the process, we can get a number you can call to be very sure regarding the current cost of IVF when it comes to this promo period. So one thing I also want to quickly shed light on that has been a major misconception when it comes to IVF is that a lot of people feel like IVF is something way different from natural pregnancy. Like, it's so different. So if anything happens, they tag it to IVF. Somebody once told me that I heard the woman did IVF, so she died. Pregnancy naturally is a medical condition that anything can happen. So it's not because the person did IVF that's why the person died. So I would like to use an illustration to make you fully understand what IVF is compared to natural pregnancy. It's just like a car, a vehicle that has a dead battery. Maybe you woke up in the morning, you want to start your car, and you put on the key in the ignition, and it's not starting. And you can tell that, oh, my battery is dead. Maybe you turn on your lights over the night, or you've been noticing that the battery has been giving some funny, moves over the weeks, and now it has died completely. But the fact that that vehicle's battery is dead doesn't mean that the car is entirely bad. No. All you need to do is to get another battery, maybe from a neighbor or a new one, or to put that battery in that car. You start the car, and the car is back to life. Now, let me ask you a question. Have you ever suspected when a car drove past you and you felt like, this car that just drove past me now, it's sounding like they put battery to start it? Have you ever sensed anything like that? It's not possible. Because once a battery is dead in a car and you replace it, it becomes, the car is back to normal. You can't tell whether the car was started with battery or so. That is exactly how IVF is. IVF is like that battery you put into a car. Once you start it, the car is back to normal. You are just assisting the car to start. That's what IVF does too. It helps the pregnancy to start. Once that pregnancy has started, it's as good as every other pregnancy that came up naturally. So there's no difference to say, oh, because he did IVF, that's why it was like this. Oh, because it was an IVF, that's why it's like this. No. What IVF does is to assist you to achieve the pregnancy. And once that pregnancy has been achieved, it's as good as a natural pregnancy. Well, I know you have so many questions to ask as we continue on the course of this webinar. So let me not let the cat out of the bag too much or preempt you with some questions you would have asked. So this is my little introduction, and be free to ask whatever question you need to ask. The ones who can answer them. The ones who cannot answer because of time, we'll always ensure that we put them down and always get back to you. Thank you very much.
Hello, everyone. Thank you, Mr. Endurance, for that wonderful section. Thank you very much. Now, I want to start with some questions we already have here with us. Then if you have any question, kindly drop the question through the chat box. We'll take your questions. We want to start by asking some of the questions we already received from some of us there. And this question, we'll be taking them one after the other.
So to begin with the question and answer session, like my co-host has said, we have received questions before this time, and we're just going to begin with them. But please, everyone who is here, who has a question to ask or who has a need to get understanding on issues relating to IVF, please leave your message, leave your concerns or your question on the chat box. We'll take it up in the course of the session. So to begin, there's a question here saying, what causes failed IVF? And maybe we'll just take this. Okay, let's take it one at a time. Okay, let's take the first two as one, and then we'll go on further. So what causes failed IVF? And after 8 failed IVF, can I still try? Can we have Dr. Imo please attend to this question? Dr. Imo, sir. Thank you.
Good morning, everyone. Can I be heard?
Sir, you can. We can hear you. Dr. Imo, good morning, sir.
Okay, so what causes failed IVF? I would just use an example of a seed and a soil. In IVF, there are 2 factors that are very important. The seed, which is the baby, and the soil, which is the womb, the inner lining of the womb. So failed IVF, the causes emanate from these 2 causes. If the quality of the embryo is not good, which is the seed, it can lead to failed IVF. And there are a lot of reasons that can make the embryo quality not to be good. Also, if the lining of the womb, which is the endometrium, is not good because of a lot of factors, it can also lead to failed IVF. So these are the 2 important reasons that can lead to failed IVF. And in order to correct it, one needs to optimize these 2 factors. One needs to optimize the quality of the embryo and also make sure that the endometrium, the inner lining of the womb, is good. That way, the success will improve. Thank you. For the second question, after 8 failed IVF, can I still try again? If a woman has had 8 failed IVF, before a woman can try again, it's important to do some investigations, to ask some questions to see if one can be able to find out the reason why those IVF failed. So if after the investigations and after doing sometimes you may need some surgical intervention. It could be that the inner lining of the womb, the endometrium is not good. You need to do diagnostic hysteroscopy. And if those factors are corrected, the woman can try again, and most times she will have a better success.
Okay, thank you so much, Dr. Imo. Thank you for that class. I hope our participants are finding understanding in what we're sharing already. Okay, so the first question is not conceiving early after marriage a sign of fertility issues? And what can be done if diagnosed of unexplained infertility? Dr. Imo, please, can you please attend to this again?
Okay, yeah, not conceiving after marriage, especially when it's up to 1 year, and in cases where the husband and wife are staying together and having adequate sexual intercourse. What we mean by adequate sexual intercourse is having sexual intercourse at least 2 to 3 times in a week. And if after 1 year, that couple has not been able to achieve pregnancy, it is called infertility, and is a fertility issue. And especially if a woman is less than 30 years. So some people will say less than 35 years. There are two schools of thought. Some will say 30 years, some will say 35 years. If after 1 year they've not been able to achieve pregnancy, it's infertility, and they need to see a gynecologist for proper fertility evaluation. However, if a woman is more than 35 years, a woman should is more than 35 years, that woman should not wait for 1 year. The cutoff for a woman more than 35 years is 6 months. If after 6 months a woman is more than 35 years and has not been able to achieve pregnancy, they should visit a gynecologist. And it's not only the woman that should visit a gynecologist. The woman should go with her husband, because infertility is a couple problem, because a woman cannot get herself pregnant. So we need to investigate both the man and the wife in order to unravel the cause of the problem. Thank you.
Hello, Dr. Imo. So sorry. The following question says, what can be done if diagnosed of unexplained infertility?
Okay, we define unexplained infertility when all the conventional tests and investigation has been done, and the doctor is unable to find out the cause from the investigation. In other words, all investigations are normal, but the couple cannot get pregnant. This is where assisted reproduction comes to mind. And one of the known assisted reproduction is IVF. So in cases of unexplained infertility, one will advise for assisted reproduction. It can be IVF, sometimes it can be IUI that will be able to correct the problem. Thank you.
Thank you, Dr. Imo, for that explanation. We want to go to the next question we have here. I had 2 failed IVF cycles back to back. How soon can I go for another one? I'm 52 and time is a factor. I had 2 failed IVF cycles back to back. How soon can I go for another one? I am 52 years. Time is a factor. Then the second question, why does IVF fail after following all instructions and procedures? Why does IVF fail? I think this question has been answered from the first one we asked before, why IVF fail. But this one, I have 2 failed IVF cycles. Please, can you help us answer that one? Thank you.
After 2 failed IVF cycles, the IVF process should be reviewed. Also, the one should do investigation, maybe do transvaginal scan to assess the endometrium. Also, diagnostic cystoscopy may be very important to look at the endometrium, because, as I said before, the soil is very important for successful IVF. And if after proper evaluation, if everything is okay, one can try again. Let's say in 3 months' time, one can try again. And it's very important to know that no matter how optimal the IVF process is, IVF is never 100%. It's not 100%. It shows that we are not God, and is that it's only God, that gives children. So, but in a good center like Lily Fertility Centre, our success rate is very high, and and every couple that comes, somehow the couple will go home with their baby. Thank you.
Thank you very much, sir, Dr. Imo, for that answer. How does ovarian cyst affect the success of IVF procedure? Can someone still go through with IVF if you have an ovarian cyst and hydrosappings on the tube? How does ovarian cyst affect the success of IVF?
Okay, ovarian cyst is a contraindication for ovarian stimulation. If a woman has ovarian cyst, you won't be able to stimulate that woman. So before you start IVF, it's important that ovarian cystectomy is done. That means the removal of the cyst. Also, sometimes the cyst may secrete some hormones that will work against the success of IVF. So it's important before IVF that the cyst is removed before IVF is done. If a woman has hydrosappings is accumulation of fluids on the fallopian tube. And what happens is that with the presence of fluid in the fallopian tube, the fluid is phytotoxic. It kills developing embryo and it reduces the success rate of IVF, the chances of a woman getting pregnant. So the treatment for hydrosappings is removal of the tube with the water. Because if you don't remove the tube, if you drain the fluid, it will still reaccumulate. So if a woman with hydrosappings, we advise that the tube and the fluid is removed. And fortunately, these days we can do it laparoscopically, which is a pinhole surgery. We can do it that day, the woman will go home the next day. So with hydrosappings, we encourage removal before trying IVF.
Okay, thank you very much, sir, for that answer. We have 3 children, all girls, and wish to have a male child. Is this possible through IVF? Mr. Eddie, please, can you help us with this question? We have 3 children, all girls, and we wish to have a male child. Is this possible through IVF?
Yes, I can say that it's possible. There's a recent technology called pre-implantation genetic testing. But I must say that the primary objective of this technology is to screen embryos for chromosomal issues before you transfer. You want to rid off the embryos of possible chromosomal issues before you transfer so that you can have high hopes of having a healthy baby. Or probably you already have a pre-existing condition, gene traits in your family that you don't want to pass on to your offspring. Maybe you and your husband, you are both AS. So you want to screen your embryo so that the baby that will be born through the IVF, whether come out as AA or AS, you don't want an SS out of as an offspring. So you can do PGT. But during the process of screening these embryos, because you are looking at the whole genome of the embryo, you can actually tell the sex of that particular embryo. Each of the embryo you are screening, because you are looking at the whole genome, you can tell if that embryo is a male embryo or a female embryo. So because of this, some persons take advantage of this to do family balancing, just like the question that was asked now. Maybe you have 3 girls, you want a boy, or you have 4 boys, you want a girl. You can actually do pre-implantation genetic testing to achieve this. It's very possible. It's very possible.
Thank you very much, sir. Another question relating to this is, what should I know about sex selection? Then the next one is also tied together. Is there any difference between PGT and sex selection? Please just help us throw more light to this.
Okay, it's quite similar to what I said. So sex selection, like I said, is a byproduct of pre-implantation genetic testing. I'll use another example to explain this. When a doctor orders for a test like full blood count, there are a lot of parameters that comes out. A lot of things you look out for during full blood count: neutrophil, the PCV, the white blood cell, the red blood cell, so many things will come out from that whole blood count. Now, that's exactly how PGT is too. When you are doing PGT screening, especially for the aneuploidy to screen the chromosomal properties, a lot of things will come out. And what will also come out from that screening process is the sex of the embryo. So because of that now, people can say, oh, since I can know the sex during the screening, why can't I just choose the sex to be transferred? So it's possible to do that. So that's sex selection. So after screening the embryo, you just want to know about the sex and transfer. That's very possible. Then, is there any difference between PGT and sex selection? Well, PGT is the major process. It's the technology of screening embryos, primarily for chromosomal properties, to ensure that the embryos are transferring do not have chromosomal issues, so that during your delivery, you will not end up having a baby with some birth defects, and also increases your chances of implantation, because when an embryo does not have a complete set of chromosomes, there's a high chance of miscarriage. In fact, one of the major causes of miscarriages is when an embryo does not have the complete set or right chromosomal properties. So when you're doing this screening, you can actually tell the sex of the embryo, so you cannot transfer the desired sex. So sex selection is more like a byproduct of PGT. As we are doing PGT, alongside you can know the sex, so you just choose if you want to. So that's how it is.
Okay, thank you very much, sir. Another question we'll have here: can I select the number of babies I want from the treatment? Maybe twins, triplets, or quadruplets?
Well, yes, it's possible, but it's not cast in stones. What this means is that you cannot be so sure, or we cannot guarantee you of the number of babies that will result from the transfer. Most centers in Nigeria do transfer of 1, 2, or sometimes 3 embryos, but we prefer to transfer about 2 or 1 embryo because of the complication that comes up with twin gestation or even triplet, understand? But the reason why we put more than 1 sometimes is to increase your chances of pregnancy. But it is possible for us to transfer 3 babies or 3 embryos, and the 3 will stay, and that will give rise to triplets. But it's also possible that after transferring 3, 2 we implant, then you will have twins. It's also possible for us to transfer 3, but just 1 we implant, and have a singleton. But there are times when you transfer 3 and no 1 will stay. So that's an example of a failed IVF procedure. When you transfer even more than 1 or 2 or 3 embryos, then nothing is implanted. So it still boils down to chance, nature, or God. But we can improve your chances of having a twin or triplets. But what will actually happen at the end of the day doesn't rest in our hands, but rests in the hands of nature and God, so to speak.
Thank you very much for that answer. Causes of failed blastocyst implantation. Somebody is asking the question: what is the causes of failed blastocyst implantation? But Mr. Eddie, please help us out.
All right. Many years ago, embryo transfer used to be at cleavage stage. Once the cleavage stage, the embryos are still having just few cells, like maybe 4 cells, 8 cells, 10 cells, or thereabout. But recently, most centers do more of blastocyst transfer. Blastocyst transfer is usually a day 5 or day 6 embryo. At this stage, the embryo is fully expanded with so many cells, and your chances of implantation is quite high. So you can tell that, oh, this embryo has a well-defined inner cell mass that forms the baby, and the trophectoderm that forms the placenta. But even after transferring a very high-grade blastocyst, sometimes there may still be implantation failure. Why? 2 major reasons. The embryo itself, though is a blastocyst, may have some chromosomal issues. You will not know. Yes, it may not have the complete set of chromosomes. Just the way natural pregnancy, people get pregnant and within few weeks they lose it, or they may actually get pregnant and the baby does not continue to grow, and they feel like, oh, I think I missed my period after like 1 week and nothing happens. That also happens during embryo transfer of even a blastocyst. So that blastocyst you're looking like, they're looking at that looks very beautiful and very nice, may not have the complete set of chromosomes. And when that does not happen, it will not continue to grow. So it will not even implant at all. Another reason, just like Dr. Imo said before, is the womb, the lining of the womb. It may not be receptive enough, even if the blastocyst is okay. So it's an equal chance of the seed and the soil. So the seed is the embryo, while the soil is the womb. So the womb may not be of good condition to receive the blastocyst. The womb may be good, the blastocyst may not have good chromosomal properties. So two of them must be equal. Just like I said, Dr. Imo said too, we are not God. Sometimes you just see everything looks fine. You tick all the box, fine, perfect, from beginning to the end, and still there's no implantation. So that is why we may have to do some further investigation when that happens. Maybe after a repeated implantation failure, we'll have to do an investigation to find out what is causing this implantation failure when everything seems fine and there's no implantation. So the bottom line is having a blastocyst is not a guarantee for implantation, because that blastocyst may not have the right, correct chromosomal properties, or the womb may not be in the right position to accept or receive embryos.
Thank you very much for that answer. Another one we have here, similar to what you've answered before, but there's a small tweak there. What are the chances of someone having twins baby after removal of fibroid? What are the chances of someone having twins baby after removal of fibroid? Dr. Imo, please, can you help us?
Provided the fibroid operation was done by a skilled gynecologist. And the problem with fibroid operation is that if it's not done by a skilled gynecologist, in the process, there may be injury or damage to the endometrium. Endometrium is where the baby stays. Provided there is no damage to the endometrium, the chances are very great that after fibroid removal, the woman will be able to get pregnant. It could be one, it could be twins.
Thank you, sir. Another one is, what are my chances of success if my AMH is less than 0.5? What are my chances of success if my AMH is less than 0.5? Dr. Imo, please.
AMH means anti-mullerian hormone, and we use it to assess the ovarian reserve of women. So AMH of 0.5 means reduced ovarian response. So in this case, we will advise that woman to use a donor egg. The issue at stake is that her ovarian reserve is reduced, and if you go ahead and stimulate this woman, the chances that you will not be able to get adequate number of eggs is there. And if you don't have adequate number of eggs, it's very likely that you will end up having poor embryo. As I said, the analogy of a seed and a soil. If you have a poor quality seed, you're likely to succeed. Thank you.
Thank you, sir. Another one we have here is, can someone with premature ovarian failure get a success with IVF? Dr. Imo.
It's similar to the question I answered. If you have premature ovarian failure, that means that your ovarian reserve gets depleted before the normal time. What it means is that you have entered menopause before the ideal age of menopause. The ideal age of menopause is 43 plus minus. The average age is about 48 years. Most women will enter menopause at 48 years. And at menopause, you don't have the ovarian reserve has depleted. So in that situation, we advise that woman to use a donor egg. With donor egg, her chances of having a successful IVF is very high. She will be able to have successful IVF. The only thing that she won't be able to use her egg.
Thank you very much, sir, for that answer. I trust we are getting answers to our questions, and those that have questions are writing down the questions through the chat box. Well, at the last phase of the questions we'll have here. So please bring up your questions so that we can take them. How long does it take for international patients to stay in Nigeria for IVF treatment? How long does it take international patients to stay in Nigeria for their IVF treatment?
All right. In our center, we do patient-centered treatment. So we treat you individually. So we look at your own schedule, your own factors affecting your travel, and we treat you accordingly. Now, there are some patients who have time to come over and stay for 2-3 months. While there are some, they have little or more than 2-3 weeks to stay in Nigeria. So if you fall into that category, we have different packages that can help you meet up with that requirement. Sometimes some persons will come for just 1 week and do their procedure and they go back. So it's just for you to get in touch with us. We'll tell you how to go about working around your time to meet up with your desired time you want to stay. You want to stay for just 1 week, for just 2 weeks, for just 3 weeks, we've got you covered. We can do that actually.
Thank you, Mr. Eddie, for that response. How long will I be admitted after the transfer and implantation of the embryo? How long will I be admitted after transfer and implantation of the embryo? Dr. Imo, please help us out.
As a rule, we don't admit patients for transfer. It's an outpatient procedure. After the transfer, you are meant to lie down for about 15 minutes and you are good to go. It doesn't affect your success of IVF.
Thank you, sir. Does your facility support NHIS? If yes, is any IVF procedure covered by any NHIS in Nigeria, Benin?
I think the person that asked the question should reach out to the NHIS personnel to know if there is any IVF procedure that his or her package covers. Provided the package is covered, we are there, we offer the service.
Thank you, sir, for that response. The last one we have here: can one with endometriosis get pregnant? Dr. Imo.
Endometriosis, what it does is that it generally reduces the success rate of IVF. It doesn't mean that a woman with endometriosis cannot get pregnant. It reduces the success rate, and with appropriate treatment, a woman with endometriosis can get pregnant. Thank you.
Thank you very much, sir, for all that answer. Thank you, Mr. Eddie, for your response too. Now I want to go live to all the questions we've received from everyone in the group that have dropped questions. The first question we have here: how soon can one start menstruating again after a failed IVF process? How soon can one start menstruating again after a failed IVF process? Dr. Imo, please help us.
After a failed IVF process, the woman should be able to see her period as usual. However, sometimes there might be a slight delay, but the woman should not be worried. Just to be patient, the period will resume back. There's nothing about it.
Okay. Thank you very much, sir. Another question we have here is: what is the main cause of IVF failure? For that question have been answered already, the cost of the answers to the other questions we had before. Now, whoever asked the question have been able to get answer to that question. Another one we have here is: I and my partner have the same genotype. If we use our egg and sperm, is it possible to check the genotype of the egg before implanting it? Mr. Eddie, please, you will help us with this question.
Yes, that's very possible. That's very possible. We use a screening method called pre-implantation genetic testing for monogenic screening. There's a type of PGT called PGTM for monogenic screening. So if you want to use your egg and your husband's sperm to achieve pregnancy, and you don't want to end up with a baby with SS, you want to have an AA or at least an AS, it is very, very possible. It's very possible.
Okay. Thank you very much. Another question we have here is: after a failed, what is the age limit to do IVF? What is the age limit to do IVF? Dr. Imo, can you help us?
For our center and for most centers in Nigeria, and as a recommendation by AFRH, the age limit for IVF is 54 to 55 years. That's the age limit. Because we also want to consider the chances of this woman, taking care of the baby. There's no point doing IVF for a woman that's 60 years when you know the average lifespan of that woman. There's no point bringing a baby a woman cannot be able to cater for. So that's why the cap is 54, 55 years.
Okay. Thank you very much, sir, for that response. Another question we have here is, after a failed IVF, how long can someone stay to retry again? I think we've answered this question in the course of answers to the previous question. After a failed IVF, how long can someone stay before retrying again? The answer we had then was, if you've done IVF before and you had a failed IVF, before you can start again, after you've seen blood one, the second time you can come again. So, Toyimo, you want to add something to that? Somebody's asking that question again, just to recap what you said before about when you can come back after you failed IVF to retry again.
As I said, after a failed IVF, one needs to reassess the IVF procedure. And you might still want to do some investigations to find out why the IVF failed. And after all this, you can try again. Let's say between 30 to 6 months, you'll be able to try again.
Okay, thank you, sir. Another question we have here is donor the same with IVF? I think person meant is using a donor for IVF, the same thing with IVF. Please, can you give us an answer to that? Eddie, please.
Yes, it's an option, because some persons who come for fertility treatments, most of them are already advanced in age. Probably they didn't have enough money to come when they were younger, or they didn't get to know about it when they were younger, or they were believing and hoping in God. And now they're already crossing 45, 46, already hit menopause. And at that age, the quality of their eggs will not be good enough for us to use for IVF. It will further reduce their chances of getting pregnant. So most times, a recommendation of using donor egg is put on the table for such kind of couple. So it's part of IVF too, using a donor egg or using your own egg. It's just an option to increase your chance of pregnancy, even though you're a little bit younger, or for those who have hit menopause completely.
Okay. Thank you very much, sir, for that response. Another question we have here is, can a woman with internal body heat have a successful IVF? Can a woman with internal body heat have a successful IVF? Dr. Imo.
For a layman, internal body heat, what we call post-menopausal symptoms. The internal body heat is because the eggs in that woman is depleted and the body is not producing the hormones that maintains the body, that make a woman to look like a woman. So the person will be having hot flushes, which is the internal body heat. A person that has entered menopause can still do IVF, as I said before. The only thing is that we'll use a donor egg to improve our chances of success. So a person with internal body heat can do IVF. Thank you.
Thank you, Dr. Imo, for that response. Somebody is asking if the recordings will be shared. Don't worry, the recordings will be shared after the webinar. We have another question in the house. How can someone have a quality embryo? How can someone have a quality embryo? Mr. Eddie, please, can you help us?
Yes. Two things that can result in a good quality embryo is the quality of the egg and the quality of the sperm. If the quality of the sperm and the quality of the egg are okay, there's a high chance that the quality of the embryos will also be very high. But if the quality of the sperm is very low, but the quality of the eggs okay, then the embryo may become fair. Doesn't mean that we cannot transfer it, but may not be as high as we wanted it to be. But if the quality of the egg is very poor and the quality of the sperm is okay, it may also result into a fair-looking embryo. But when the quality of the egg and the sperm are optimal, then you should get a good quality embryo. Then your culture system, your environment, and how you handle the sperm and the egg can also contribute to all of that. But a major factor that contributes to the quality of your embryo is the quality of the egg and the sperm. And sometimes these things are genetic. From the morphological or physical assessment, you can see that, oh, this sperm is looking very good, this egg is looking very good. But at the end of the day, you see a poor quality embryo or a quality of embryo that's not really up there. And you're like, wow, what is it? This sperm looks very nice. This egg looks very nice. How come we're having a low quality embryo? So some of these things are not really what you can explain completely. But the major thing that can contribute to the quality of your embryo is the quality of the egg and sperm that forms the embryo.
Thank you, Mr. Eddie, for that response. Another question we have here: during the process of IVF, do I need to be admitted for some days immediately after transfer for someone who comes from outside the town? I know Dr. Imo has shown some light to this. After transfer, you don't need to be admitted after the transfer to stay for some days, but there are accommodations around where you can stay, like hotels, even from the hospital, that you can stay around if you come from outside the town to rest, then probably move the next day or whenever you want to go. Then another question we have here: how much is IVF, and do you have accommodation package for patients outside Nigeria? Mr. Eddie, please help us with this answer.
You mute yourself. You can't hear you. Mute yourself.
Okay, thank you very much. All right, so for accommodation, we can always sort that out. If we have challenges with getting accommodation, if you live outside the country or outside the state, we can arrange that for you. Then for the price, I don't want to give a figure that is not correct now. So the hosts will drop a number that you can call at the end of the program to be very certain of the cost of IVF. Thank you very much.
Thank you very much, sir, for that response. Another question we have here is: can one travel immediately after embryo transfer? Dr. Imo, this question is coming over and over again. Can one travel immediately after embryo transfer? Please kindly respond to this question.
Yes, the person can travel after embryo transfer. It doesn't change anything. IVF, as Eddie has said before, it's just that you change the battery, just the onset, the pregnancy. You use the pregnancy is just achieved outside the body and it's into the after then. Everything is normal. It's just like a woman that gets pregnant, natural pregnant. Doesn't the woman travel if you want to travel? So the woman can travel. It doesn't change anything.
Thank you, Dr. Imo, for that response. Another question we have here is: please, can you talk about the discounted IVF package? Can you talk about the discounted IVF package? Mr. Eddie, please help us out.
Okay, just like I said before, IVF is quite expensive all over the world. In fact, in some Western countries, you almost have to spend a fortune to be able to run an IVF cycle. That's why we see most of our diaspora clients or brothers and sisters, they come into the country to do IVF because of how expensive it is over there in the US, Canada, UK, and the likes. So because of that, most centers like us, once in a while, try to see how they can reduce the cost of IVF, to the barest minimum, so to speak, so that as many persons will be able to afford it. Although it's still expensive, even when you try to price on the price, it's still a little bit high, but compared to the normal regular price, at least some persons will be able to key into the program. I will give a long period of time for people to make payments, maybe up to 2-3 months, so that even if they don't pay once, they can pay on installments before the time frame elapsed. Like we are currently running a promo now, which is something like a synergy between a Hedu Foundation and Lily Hospitals in offering a discounted IVF that started in December this month. So payment for this discounted IVF started in December and it's going to run through March. So payment for the procedure started in this December and is going to run through till March next year. So it doesn't mean that you must do your procedure within that period. It's just the payment period that elapsed within that December to March. So you can come to run a procedure if it's not coming for you this time, maybe in April or May or June, depends on when it's convenient for you. And the same treatment option we give to people for normal regular cycles is the same treatment option we give to people who do bonanza. So the only idea of the bonanza is just try to help humanity or help couples out there who may not really have so much, so that we can crash down the price a little bit for them to be able to key into this discounted cycle. So I'm going to, I will ask the host now to call out a number that you can call to get more information regarding the payment, account number, or things like that, in case you need that. So maybe only after my comments, you can just call out the number that you can call so they can write it down. So after the program, they can call to get more details regarding the payments, the amounts, and how to do that. Thank you.
All right, thank you so much, Mr. Eddie. We are about to drop in the a bill on the chat box for everyone who is following us here. You can check for it, and then you would see all of our contacts. Wherever you are, Warri Benin, you have the contacts on the bill, so you can make do with them. So to take us further, we are going to as well entertain questions from the participants who are unable to leave a message on the chat box. So if you have a question to ask, do well to raise your hand, and then we would take your question live. So whilst we're expecting them, we would go back to the messages. Oh yes, so we have someone's hand raised up already. That's Joy. Hello, Joy. Hello, Joy. Whilst we're going to have Joy speak, Udochukwu, we can see your hand raised up. Can we have your question? Udochukwu, are you there? All right. Whilst we're waiting to have Udochukwu speak, we have Ella Tejiri on the queue. Tejiri, can we have you speak?
Hope they are not muted. They have to unmute their mic to be able to speak.
Ella Tejiri, okay. Another way to this, Ella, can we have you speak now?
Yeah, can you hear me now?
Yes, we can. Thank you so much.
Okay, good morning.
Welcome. Good day to you. Good morning.
See, the question I want to ask, though I typed, but I was not getting response. I said, in a situation, maybe we use a donor egg or maybe sperm. Like, you know, in some family, they do have issues like all these hereditary disease. So maybe in a situation like that, I don't know if the child will have that disease or there will be a screening.
Okay.
Hello.
Thank you very much. Thank you very much for your question.
Okay.
Yeah. We do general screening for all donors. A question I like asking in this regard is, if you want to get married to a man or a woman,
Yes, sir.
what are the tests you do? Basic tests: blood group, genotype,
Genotype.
HIV,
Yes.
hepatitis. Finished. Do you know whether
Yes.
the person have any genetic issues or in their lineage? You don't know. You just do the basic test. Not as much as you love the person and you like the person, you are compatible. You do your normal HIV, hepatitis, and common infectious disease genotype, and you're cool, and you get married. Understand? That's what happens too. So what we do with our donors, we do all the basic medical screening to read up all those things like HIV, hepatitis, and some gene traits like genotype and all that. So once those are done, and we've done all our IQ check and a few questionnaire and documentation, then we are good to go. So we have our criteria though. We have our donor selection criteria. We have a minimum standard that must meet up to before they can be fit.
Okay, sir.
Yes.
All right. Thank you, sir.
Thank you so much, Ella, for calling in and joining us as well on this session.
Yes, ma'am.
Going forward, we will take on MOD. So if you wish to have more clarity, okay.
I was supposed to ask question and my mic was muted.
Oh, so sorry. Who's speaking now? May I know you, please? Can you tell me? Udochukwu. Okay, we can see you here. All right, please go on with asking your question.
Okay, my question is for somebody who is living outside Nigeria and is planning to come for the procedure, a man. The question is regarding the test. Given the nature of my job, it's not something that I can stay more than 2 weeks in Nigeria. Regarding the test from my own side, what are the tests that are supposed to be carried out as a man? And how, although the doctor has mentioned it, how long is the test gonna take? Like testing the your HIV status, your genotype and blood group and all of that. How long is it gonna take? That is one. Two, for a quality sperm, what are the things, the diets that is required to eat, or some of the things that I could do to enhance sperm count and the quality of the sperm?
Okay, thank you very much for that question. So like I said before, for our diaspora clients who may find it difficult to spend longer time in Nigeria, we have a package for them where we'll see how we can have a synergy with a clinic or a consultant gynecologist over there in their country, who will walk them through some initial investigations. Like those preliminary tests you're supposed to do, you can do them over there, both yourself and your wife. You send us the results. Sometimes we can even send you medication or send you prescription on how to get medication over there. And you start your treatment there. You do your scan, you send us a report, you look at them. Then we keep, conversing online with your reports being sent to us. By the time we know that you are close to your transfer date, where you will spend just about a week or two, they can schedule for you to come over. So you don't have to even come over to do the test. You can do the test where you are. And depending on your time, you can even start your treatment over there before you come, so that it makes the whole process very short when you come to Nigeria. Then for improving sperm quality, it's just changing maybe a lifestyle when it comes to diet, maybe eating more fruits and vegetables. Then if you are someone who sits for a long time because of the nature of your job, try to see I can engage in some exercise. Then try to avoid maybe wearing tight-fitted underwears. And if you are the kind of person that maybe used to put maybe laptop on your lap most time when you are working, you try to avoid that. Then you can also cut down on your intake of alcohol. Yes, cut down your intake of alcohol. Then if you already be diagnosed of low sperm count, it will be wise to completely cut off smoking for the entire period, because it's quite inimical to the sperm quality and also the count. Those are the few things you can do that can improve sperm quality.
Okay, further to your question, sir. I am based outside Nigeria, but my wife is based in Nigeria. So the issue of liaising with a physician here, does it come in, or am I to observe these things that you mentioned from my own side as a man to improve a health?
Okay, it makes it easier. Since your wife is here, it makes it easier. So all we need from you is just to come and spend about a few days. Yes. If you enter Nigeria today, the next day or 2 days after, you can do your test. And that test result can be out that same day or the next day. Then that same day that result is out, you can freeze your semen sample with us. You freeze it, then you go back. So in less than a week, you are done with everything. You go back, you know we have your semen sample with us, while we continue the treatment with your wife. And we use a frozen sample to do the fertilization and the transfer.
Okay, thank you.
Yeah, welcome.
Thank you so much, Dr. Chiku, for joining us on this conversation. Our offices are opened. You can furthermore reach out to us at Lily Hospice. We're back again. Can you please confirm if you can hear me? Hello? Can you hear me?
Yes, we can hear you.
Oh, great. Thank you so much. Okay, so we'll go on further to MOD. MOD's hand is raised. MOD, please, can you ask your question? MOD, are you there? MOD, please unmute and speak. All right, so whilst we expect MOD to speak, we have Eunice. She's also on the waiting line. Can we have Eunice? Can we have Eunice? Okay. All right, Eunice, Otai, can you unmute and speak? Otai, can you unmute and speak?
Hello.
Yeah, we can hear you.
Yeah, good morning, ma.
Good morning to you. Who's speaking, please? Is it Rachel?
Yes, this is MOD.
MOD, oh great. Please go on. Thank you for joining.
This is MOD from Asaba, yes. I want to ask if, because I did a procedure with the hospital months back and it failed. So, and I wish to commence again this January. So I want to find out if I will still undergo all those steps I did before now. So that's my question.
All right, Dr.
Hello.
Imo. Dr. Imo. Dr. Imo. Okay. Is Mr. Eddie there?
Okay, fine.
Oh,
Well, good to hear from you, ma. And it's good we are hearing from you too. And I believe we've also done some follow-up on the failed case. Well, like the Tomo said before, we have to do a review. And I believe we must have done a review since it's up to like 2-3 months back that you had the failed case. For us to know if there's anything that we can do differently for us to improve our chances of success. But most of the time, if it's not up to 6 months, you don't have to do all the tests again. Yes, but once it's more than 6 months, you have to do especially most of those disease screening like HIV, hepatitis, and the rest. You have to do them again. You have to do more than 6 months. Which sometimes 3 months, but it depends on when you find the rest. So you don't have to go through all the process again. But once you do a review of your case, I noticed that there are 1 or 2 things you need to do, maybe like a endoscopy. Maybe you had a very good embryo and a very beautiful looking womb, and the transfer was smooth. I didn't get pregnant. We have to take, let's do it to see if there's anything in the womb that may have reported in the failed case. So what you need to do is just to call the hospital since you are far, book an appointment to do a review. Can we do a review with you online? If you want to do it, that's you have to repeat all the test case. Maybe it's a long time ago you had a test case. Hope you got me. Yeah.
Okay, Emily, please wait.
Yes, I am getting you, but my network is. Okay. Yes, I heard him. I heard something about review. I didn't do the review after the failure anyway. So I don't know if it is late or.
No, it's not late. No, it's not late.
Okay.
It's not late. Yeah. So just book an appointment to come for a review. Yeah, as about it's not so far. Just book an appointment to come for a review, and you look at your file from beginning to the end. We will do some scans for you, and let's see if there's anything we can say. Oh, probably this is what may have caused the failure. So let's see how we can correct it and things like that. Yeah.
Okay.
If there's anything you need to do before the next one, we'll definitely let you know.
Okay, no problem, sir. Grateful.
Yeah.
All right.
Thank you for presenting the hospitals.
Thank you, sir.
Thank you for joining us here. We would furthermore take on Rachel. Take Rachel's question. Rachel, are you available to speak now? Rachel, are you available to speak now? Okay, so we're still waiting for Rachel to. Oh, yeah. I can hear you. Who's on, please? Who's on the call?
It's me, Rachel.
Oh, great. Rachel, good day to you.
Good day, ma'am. My question has been answered already because someone asked exactly the same question I was about to ask. But I still need to ask another one concerning people in diaspora. He answered that there is a test that he will send to them. They will run the test over here. Maybe we will test the results to them. I want to ask, what about those people who are not living in English country? Because I need to test, how will they be able to translate the test over there in Nigeria?
I don't know if we can unmute ourselves. It's like there's a lot of people that are not muted, so it's causing interference. So that the only person that will be unmuted is the person speaking currently. So can you come again with your question and let's ensure that we are unmuted so that I can hear you clearly.
Okay, my question is, you just answered the former, but I still have more to throw on that one. Those of us living in diaspora, you said you send us some tests. We have to run the test over here. So I want to know, what about those people who are not living in an English-speaking country? How are you going to translate the test over there?
Okay, yes, we have people like that. Spain or Germany or European countries. Yeah, we have a lot of people who have done that test and send it to us. Now, what they can do, they have a center where they can do translation there. They have a center where they can do translation. We have some couples who are able to translate their results and find out to translate their results before they brought it. Or you can even make a request. There are some clinics who make a request to them, help you translate it before they give the results. That's very possible. At times, because some medical terms sound or appear alike, we may be able to know how you can, but it's always the case that you have translated for clarity's sake. So you find out from there, is there a point or an outfit that does translation of documents, results, letters, and all that, and even the clinics too. You can also, maybe we have to pay a little more, but I'm very sure that there are centers or clinics who the request for results consultation, they will do it for you. You have to pay a little extra for that. I've seen couples who are from most European countries that don't speak English as their primary language, and they have their results in English translated already.
Okay.
Yeah.
Thank you very much, sir. Please, Mela, I want to ask another question.
Okay.
Like the treatment you said, someone has to be on treatment before it comes down for the transfer. Like how long will it be on the treatment before coming down for the transfer?
Well, that is when you really don't have much time to spend at all. But if you have a little up to about a month and maybe a few to spend, you may not have to start your treatment there. But if you have just like 2 weeks to spend in Nigeria, that's when you have to start the treatment over there. And the treatment will take about 2-3 weeks before you come here. But by the time we started, we explain the process to you in detail on what you need to do. But between
Even
2-3 weeks.
The person using don't need to be placed on treatment?
Yes, you have to be placed on treatment over there if you don't want to spend much time here. Understand? If you don't want to spend up to like maybe 4 to 6 weeks here, then you have to start your treatment there before you come to Nigeria. And that treatment may take about 2 to 3 weeks before you come to Nigeria, depending on how fast you respond to the medication you're taking. Do you get my point? What I mean is that once you start your treatment, you may take that treatment for close to 2-3 weeks. They will not schedule your appointment to come to Nigeria. Once you come to Nigeria, in a few days, you are doing your transfer. You can go back after like 2-3 days, or if, depending on your time. It's just your time factor that will determine how long you are staying. You get my point? It's like network has cut out off.
Oh, thank you so much, Mr. Eddie. There's Okay Thomas on the queue. Okay Thomas, please unmute and speak. Let's quickly take your question. Hello, Thomas. Okay. Or any other person who's ready to speak could come on, raise your hand and speak. All right. I can see. Okay. Okay, Eunice. Amina too. Okay, Eunice. Can we have you please? Can you unmute and speak?
Good afternoon. Good morning.
Good day to you. Thank you for joining us here. Welcome. Please go on.
Okay, I want to ask some questions, maybe just a few. Go ahead.
Yes, please go on. Yeah, please go on.
Okay. Regarding the treatment, it's for those who have issues with maybe their eggs or their sperm, or is it compulsory that everybody, if whether their sperm, their semen is still okay, or their eggs is okay, and they want to go through that process of the IVF, do they need that treatment? And that is one. Two, the treatment, the cost of the treatment is separate from the cost of the IVF. Second question. So maybe I will have other follow-up questions. Maybe these two will do for now. Thank you.
Okay. Thank you very much for your question, sir. Well, that is why before you start any fertility treatment, you must do investigation. The man and the woman have to do some tests. You can know exactly what is going on. There are some young couples who walk to our facility and say they want to do IVF. But after the investigation, notice that they are not even, IVF is not what they need. Maybe just IUI or just some few corrective reproductive surgery that they will need. So once you have done your tests, the result comes out, we just oppose that with the age of the woman most of the time and be able to tell if you are going in for IVF or not. So it's the result of initial investigation that determines what we are going to do or the treatment option we're going to offer you. So that's the baseline. Then for the treatments, the cost of IVF covers all forms of treatment, both the drugs and the theater work, the injections, the scans, and all that. The only thing that doesn't cover is the initial investigation you will do in the laboratory. The cost of IVF doesn't cover that. But the cost of IVF covers your medication, the culture, the transfer, and everything. But if there are other extra things like maybe sperm freezing, maybe the husband will not be around, he's traveling, you want to freeze your sperm, you pay extra for that. Or probably during the transfer, we had good embryos that were even in excess, that will have extra embryos want to preserve for future use. You have to pay for that, you know. Or maybe during the initial investigation, notice that you have fibroid, you need to remove the fibroid, you pay for that. Or maybe you've done fibroid before, and we'll tell you that for you to increase your chance of success, you need to do hysteroscopy. You have to pay for that. But for the treatment of IVF itself, the cost covers everything. The cost covers everything.
I ask a follow-up question on that.
Okay, please go on. Please go on, Mr. Eunice.
Okay, what of a patient who have done undergo some of these investigations and would like to come down with their results to you people to see and know the necessary things that you people can. So what will be the procedure for that person?
Yeah, that will be with the discretion of the gynecologist who is attending to you. One, he has to look at how long ago this investigation were done. Some of them that are very crucial and critical, he may want you to repeat them again so you are sure what you are dealing with. And when there are some that are not so crucial, you may just, okay, fine, we'll do it. So that is left to the discretion of the gynecologist who will be handling your case or who will be doing your consultation. But if the results were a result of 4 or 5 years ago, definitely you want to repeat them. But if they are recent, and maybe probably from labs that are well recognized and we know, no problem, can go ahead with the results you already have. But there are some crucial ones that he may want to repeat so that we are sure of what we are dealing with. So that's it.
Thank you. Thank you.
Oh, great. Thank you so much, sir. I trust your questions was well attended to, Mr. Eunice. We have Tamara Priye. Tamara Priye, please, can we have you on mute and then speak? Oh, she's gone off. Oh, she's back again. Tamara Priye, please unmute and speak. Thank you. Okay, Tamara Priye, we're still waiting for you to speak up.
On now.
There?
Okay, thank you very much.
Thank you for joining.
I dropped a question in the chat box, but I don't know if that's been answered.
Do you know who's speaking? Is this Tamara Priye speaking?
Hello? Can you hear me, please?
Yes, I'm listening.
Tamara, okay, yes. I said, please, considering age, well, not really about age, assuming Okay, yes, considering my age, I just want to go first, straight up to do IVF. Not that I've tried and not that I've been told that I cannot conceive naturally. But I just want to go straight with the IVF, particularly because I'm thinking of having maybe more than one at once, like twins or having triplets. That's not really a question. That's just a, how will I put it now? So assuming now I do that, God forbid, and it fails, can one try to conceive naturally? Does a failed IVF affect chances of conceiving naturally? And that's one. And then after the transfer, are you supposed to stay away from your partner? Can you have intercourse with your partner and stuff like that? That's my question, please. Thank you.
Dr. Imo? Dr. Imo?
Hello?
Yes, we're here.
What's the question, please? What's the question again?
Okay, so she's asking that, Ifunaya, she's asking that, can she give a trial to doing IVF? Because she's of age and she wouldn't want to go through the normal process. So if she considers doing an IVF and likely the chances fails, can she now furthermore try out a natural conception? Will a first IVF trial affect the chances of having a natural conception? And also, when the IVF process is done, can she have sex with her partner? Is she allowed to go on at sexual activity with her partner? So this was her question.
Okay, it depends on her age. You know, the age plays a critical role on woman's chances of getting pregnant. If she's young, if she's less than 35 years, and also depending on the reason why she has not been able to get pregnant. If she's less than 35 and her tubes are open and the husband's semen is okay, in cases of unexplained infertility, she can be able to get pregnant after IVF. But if there are some conditions in her, or if age is not on her side, the chances are not high after IVF. And sleeping with her husband after transfer, most authorities will recommend her not to sleep with the husband in the first trimester. After the first trimester, she can sleep with her husband because the risk of miscarriage is very high in the first 3 months. So we don't want anything that may increase her chances of having miscarriage, because IVF achieved pregnancy is a precious pregnancy, it's a precious baby. So that's why we say we normally advise to abstain from sexual intercourse in the first 3 months.
Thank you so much, Dr. Imo. Ifunaya, I hope your question was well attended to or answered. Ifunaya.
Yes, thank you. Thank you very much.
Also, sorry. Thank you so much.
And another thing too is that trying IVF doesn't mean you will not be able to get pregnant naturally. There are even some persons who, in the process of doing IVF, as they come for their next scan, we put probe there and we see pregnancy. Or there are some persons, after doing IVF, they get pregnant. As they are planning to come for the next cycle, they will call us and say, God has done naturally for us, so we are not going to come for IVF again. You understand? So it's happened like that. So you're doing IVF does not reduce your chance of getting pregnant naturally. So
Okay. Okay.
To worry about.
Okay. Thank you.
All right. So we have, thank you so much, Tamara Priye. You can reach out to us furthermore after here and then get to know more about how we can book a session with you.
Okay, thank you. I appreciate that.
You're welcome. Thank you so much. Okay, so we have Okay Thomas. Okay, Thomas, are you available to speak now? Please
Yes.
unmute and speak. Oh, great. Okay, Thomas, please go on with your question. Welcome here.
Okay. I think let me just ask a follow-up question to the last person that asked. Can we repeat the IVF stuff after the first? Maybe this you can repeat second. No, that is. I just want to get clarification on that. My question: can we repeat 1, 2, just like that?
Sure, you can. You can. The truth is that IVF is more like a trial. You are not 100% sure if it's going to work or not. Although for some centers with high-skilled embryologists and gynecologists, nurses, and following up to this standard, their chances of pregnancy is high. Understand? But it doesn't mean that you must get pregnant. Maybe out of 10 persons in the batch, maybe 8 will get pregnant. So the other 2 that didn't get pregnant, we have to try again the second time. So in the second time, they may get pregnant. Even sometimes that second time, you may not still get pregnant again. You see, some parents have done IVF up to 3 times, even 4 times before they got pregnant. So that's exactly how it is. But what we do is that after the first failure, you must do a review to see what happened, so that if there's anything we can place our finger on, we don't have to improve on that or try to see how we can make the chances of getting pregnant higher in the next trial. So there's nothing bad about trying again, second time or even third time if you had a failed case. Except there's a clear reason why you are failing, and we know that if we continue, you're still going to fail, and that's okay. Let's try another option, maybe using a surrogacy or other options that can increase your chances. So trying the second time or the third time is very normal. It's very normal.
Thank you very much.
Thank you. Thank you, Mr. Thomas, for joining us here. I hope you found clarity to your question.
Okay.
Right, so we'll take on Erons. Erons, can we have you speak, please? Can you unmute and speak? Erons. Erons, are you available?
Yes, good afternoon.
Good afternoon. Welcome here. Thank you for joining us.
Please, I just want to find out, is it possible after embryo transfer, let's say in a week after embryo transfer, is it normal to feel bloated and see brownish or pinkish internal discharge?
I think it's normal for most women, because after embryo transfer, you are placed on estrogen support, depending estrogen and progesterone support. So those hormones will make you to be, to have breast fullness, and also coupled with the effects of early pregnancy. You have breast fullness, you feel bloated. So those are normal early pregnancy symptoms, and shouldn't be worried about them.
Thank you very much.
Thank you.
Thanks for joining us here. Thank you. So, Aminatu, are you available? Aminatu. Okay, so maybe we'll go back to our question and answers that were dropped in the chat box. We'll just go on from there and engage a little, and trusting that would have been able to go through all. So, there's a question dropped here saying, what is the treatment and chances for women with HX of stenotic cervix? Dr. Imo, what is the treatment and chances for women with HX of stenotic cervix?
Okay, cervical stenosis is when the cervix is not accessible due to many reasons. It could be that the woman used a herbal pest. It started some herbal medicine to her vagina, and that herbal medicine burns, damages the mouth of the womb. It could be also as a result of maybe dilatation and curettage that was not done well. So it's difficult assessing the womb, because you have to assess the womb through the cervix, which is the mouth of the womb. So for such cases, there are surgical opening of the cervix. We can surgically open the cervix. After that, they can do a successful, can be able to carry out a successful IVF. So a woman with a cervical stenosis can be offered IVF.
Thank you so much, Dr. Imo. So we want to take on the next, the other questions that are put here. Some of the questions, please, to our participants here. I believe that we have been able to go take on the questions some of us have asked here. So should in case it is not mentioned again, I believe that clarity has been brought in that wise already. So there's a question here. Can a donor sperm have any features of the male partner? Mr. Eddie, yeah, or Dr. Imo.
Okay. What we do is when you are doing donor selection, especially for both male and female, actually, we try to see how we can make the physical look of the donor resemble the intending couple. Not like 100%. It could be the height, it could be the complexion, it could be the BMI and things like that. But one thing I always explain to couples is that even if you get a donor that looks 100% like the man, there's a chance that that child that will result from that program or from the IVF process may never look like the donor. There are some persons whose children look like their grandmom. The child will not look like the mom, like the daddy mom or like the dad. Will look like someone in the family. Understand? So that's why sometimes see a fair man or a light-skinned man or a light-skinned woman, one of their child may be dark-skinned. Maybe the mom of the dad or the mom of the woman is dark-skinned. But there's that recessive gene sometimes that can become dominant during the lineage of creation. But what we do, we try as much as possible to ensure that at least there's this form of resemblance when it comes to the height, complexion, and other features that are necessary.
Okay, thank you very much, Mr. Eddie, for that response. We have another question in the house. What are my chances of successful IVF? I'm 25. What is my chances of getting a successful IVF? My age is 25. Dr. Imo.
At 25, your chances are very great. Because as I said before, the age of a woman plays a significant role in determining the success of IVF. Because if a woman is younger, that woman will most likely have good quality eggs. And good quality eggs will give rise to good quality embryo. So at 25, the chances are very, very great.
Thank you, Dr. Imo, for that response. We have another question. Can you please give more information about international patients coming for IVF? Can you please give more information about international patients? I know we've answered some of these questions in the course of the webinar, but just to throw more light, a flyer will be shared or it's already shared on our screen. There are numbers you can reach out to so that we can guide you through your plans for coming down from any part of the world for your IVF in Lily hospitals. We'll have a package for you. Either you're going to be doing your test over there, coming down here for anything, we'll have a package for you. So feel free to reach out to any of our lines on the flyer and we'll be able to plan with you. Right from your coming down, your accommodation, everything you would need, we'll have a plan for you. We'll also send you emails to guide you through Also check out our website for any further questions. Then another question we have here. And in the case of donor egg or sperm, is there no hereditary disease attached? Like in case where the family has some particular disease, won't it be passed to the child in a situation or donor sperm or okay? I think this person is trying to ask if there's a chance of passing any particular genetic disease from the donor to the child. Eddie or Dr. Imo can answer. Dr. Imo, are you there?
Please come again. Please come again, please.
The question, somebody is asking, is there any chance of passing any hereditary disease through the use of donor egg or sperm to the child, the potential child? Any risk of passing any hereditary disease through the use of donor egg or sperm?
The risk is minimal, or is minimal, but there are some little risks of transmitting genetic disease, but it's minimal. And bearing in mind that we don't do genetic screening. We don't do genetic screening for our donors. So what we do is the general medical screening. So there's a small risk. Because if we go ahead to do genetic screening, the cost of IVF will be very expensive that a lot of people will not be able to afford to do it. So that's why we don't do genetic screening for our donors.
And just like I mentioned before too, in natural pregnancy or when people get married, you meet a woman. You don't do genetic screening when you meet a woman or when you meet a man. You meet a man and you like him and you feel you are compatible. All you do is the basic text: HIV, hepatitis, genotype, blood group, finished. You don't go and do beta thalassemia or karyotyping or whatever, maybe cystic fibrosis and the rest. You don't do all those. It's the basic test you do. So the same amount of chances of having some gene trait transferred from the lineage of your husband or your wife is the same amount of chance you have when using a donor egg or donor sperm. So it's not different from when you get married naturally to a woman.
Thank you very much, Mr. Eddie, for that response, Dr. Imo, for that response. We have somebody is asking us to drop our WhatsApp group here. Soon we will drop the WhatsApp group link so that you can join. Due to our schedule of work in Europe, can we stay for 2 weeks or 3? I think this question has been answered before in the course of the webinar. Another question we have here, in case of screening, the child genotype, how much does it cost? Okay, in the case of screening the child's genotype, how much does it cost? Eddie, please, can you answer this question for us, Mr. Eddie?
You can also contact any of the numbers on the screen and you'll be given a detailed explanation of the costs and the implication. So just ensure you get the number on the screen.
Okay, thank you very much for that response. Also, another question. Also, for someone who has low sperm count but has been boosted and have some healthy ones, would there be any difficulty getting sperm for IVF? I presume that's what the person is trying to ask. It wasn't complete. The question is also for someone who has low sperm count but would have been boosted and have some healthy ones, would there be any difficulty? That's the question.
No, not really. In fact, low sperm count is one of the reasons for IVF. So, in as much as there is sperm and the quality is fair enough, there's no problem. You can always have sperm to inject the eggs.
Okay. Thank you very much, sir. Another question, we're trying to run, our time is almost up. We're trying to run through the questions. Is IVF a painful process, especially the transfer process? Is it painful?
The transfer process is not painful. In fact, it's painless, just slight discomfort. But if a woman has to undergo ovarian stimulation during the egg pickup, she might have slight pain, but we normally do conscious sedation, so the pain is very bearable. So generally, IVF is not a painful procedure.
Thank you very much, sir. Another question added to that is, can one drive herself after embryo transfer? Can one drive herself after embryo transfer?
Yes, someone can someone can drive herself after embryo transfer.
Okay. Can I donate sperm in advance before the day of the procedure since I live abroad? Can I donate sperm in advance before the day of the procedure since I live abroad?
Sure, you can. We even recommend that to almost everybody, just in case on the day of the treatment you are having challenges or something comes up as an emergency, you are not around. So that is very possible. In fact, we recommend it to almost all patients to do that, so that on the day of the treatment, if there's an emergency, they will not be stranded.
Okay. Thank you, Mr. Eddie, for that response. Another question we have here is, please, I base in Lagos. Hope the package is accessible from my location. I base in Lagos. Can I access your package from my location? Mr. Eddie?
Yes, you can. You can. Whatever location does not matter, but if you want to know more about our branches we have across the country and the services we can offer you in each of those branches, you can also call us on this number. I will give you more details.
Thank you very much for that response. To add to that, we can also plan with you from your location such that your coming and going will not be stressful. We can plan your appointments before you come from whichever location, wherever you're coming from. Just reach us through the numbers shared on the screen. Another question we have here, 7 days after embryo transfer, is it normal to be bloated and see brownish/pinkish vaginally discharge 7 days after? Dr. Imo.
I think Dr. Imo has answered that before.
Yeah, we've answered the question. It's normal.
Yes. Okay, another question we have here. Can a woman whose egg that is not matured enough be used for IVF? That's the person is trying to ask if a woman's egg, I think we've answered this question. If the egg is not matured enough, can it be used for IVF? But Dr. Imo, can just throw a little more light on this so that we'll move on to the next question.
It depends on what the person means by egg not being mature enough. It depends on what the person means. But if egg is not matured enough, it can still be used, but just that the resulting embryo may not be the quality may not be so good. It can be used, but the quality of the embryo may not be good.
Thank you, sir. The person can reach out to us for a clearer question and answer to whatever bothers him or her. What are the indicators that a man's sperm of quality can be used? What are the indicators that a man's sperm is of quality and can be used? Eddie, please.
Okay. A simple semen analysis can tell you that. That's why one of the major or important tests that the man does before he starts IVF is SFA, seminal fluid analysis. So from the result of the SFA, you'll be able to tell if it's suitable for IVF or not.
Thank you very much, Mr. Eddie, for that response. Another one we have here is, what is the success rate these days for IVF? What is the success rate?
Okay. I can only tell for my center and a few centers I know too that also publish their results. We are currently doing between 60 to 70% on the average across all age group. It's not fixed across every month, but on the average between 50, 60 to 70%. What this means is that in every 10 patients that come for treatment, at least 5 to 6 or 7 gets pregnant. In every 10 patients that come for treatment, at least 5 or 6 or 7 gets pregnant. So that's our current success rate we are graduating now.
All right, thank you everyone who has joined us on this session. Be assured that the audio recording will be shared with us, everyone who registered and has joined here. And if you have furthermore questions to ask, you can do well to write us. Okay. Also to note, the WhatsApp link, the WhatsApp group has been shared with us. The link has been shared to our WhatsApp group. You can click on the link to join. Yes. We're glad that you have joined us here. We would like to use the few minutes we have to talk about our promo. We have an ongoing promo, and we would like to have Mr. Eddie talk about it so our participants can understand what we're doing at this time and how much we are discounting for this procedure. Thank you, Mr. Eddie.
Okay, I think I've mentioned the answers before. Like I said, infertility is quite a pain in the neck most times, and it's a medical condition that has been there for a long, long time. It's almost as old as human. And over the years, medical practitioners and scientists have always sorted out ways to ensure that they keep preferring solutions on how to treat infertility. And because of the kind of sophisticated equipment and medications and the environment used for the procedure, it's a little bit expensive across the globe. In fact, in Western world, it's even more expensive. That's why we see that recently or lately, most of our brothers and sisters in diaspora, they come here to do their IVF. They come to Nigeria to do their IVF because of how expensive it is over there, or to access some services that they may not be able to get over there. So we try as much as possible at some point crash down the price of the IVF or the cost of IVF so that many persons, as much as they can afford the IVF. Even the amount that is being crashed down to may not be very cheap too, but at least to a large extent, some persons will be able to plan and prepare for it because we give an ample period of time for them to make payments, sometimes up to the period of 2-3 months. And this period of payment doesn't mean that you must have to do IVF that period. Like our current discounted IVF package, which is being sponsored by a Hedu Foundation in conjunction with our hospital, is spanning from December this year to March next year. That's about 4 months, you know. So that's a period of payment can help you to even pay on installment. If you cannot pay once, pay on installment. So by the time you are done with your payment, you can start your treatment immediately when you have done finished your investigations. So this helps to allow more persons to be part of the IVF process, to give them the opportunity to have a baby of their own. And the form of treatment we give to people during the bonanza period is the same form of treatment we give to people who pay normal regular price. Everything is the same. We're just trying to see how we can give room for more persons to come and be part of the IVF process. Like we said before, the number is on the screen that you can call to be very sure of how much you need to pay and some other details regarding payment, maybe account number and things like that. Or some other small questions you want to ask regarding the payment process and all that.
Thank you so much, Mr. Eddie, for shedding light on the promo and for the time you have spent here with us. I want to say thank you also to Dr. Imo Nelson. Thank you so much for the clarity and then the understanding you have brought to every participant who was here today. And also, I'm not leaving out one of our clinical embryologists who is here with us as well, Oluchi Oladapo. Thank you so much for your time as well. And also to all our participants who joined us on this session, thank you for joining us. Be assured that the audio recording will be shared with us after the session and also on all our social media platforms. You will have the recording. To ask or to make 1 or 2 clarity on what has been talked about. You have our contact on the bill. And also, if you have joined the WhatsApp group via the link that was shared on the chat, you can as well leave your questions there. They will also be attended to. Once again, thank you for your time. Do well to take advantage of the promo. Help us tell persons who will be interested in it to stop by and then inquire more about the promo. Thank you once again for your time. We're glad that you have joined us. Do have a great day. Bye for now.